according to the Associated Press, right after the election, total support for the new law was a meager 38%. Those totally opposed to the new law was a whopping 47%, with 12% somewhere in between. Now, total support for Obamacare has ticked up to 40%. Total opposition to the new law down 6% to just 41%, but the undecideds also up to 16%. Let's hear now from the Georgia Republican who, before the awful events in Tucson, said those fighting words about shooting the health care pig. He's Congressman Paul Broun, a doctor of 40 years, one of the Republicans leading the charge to repeal health care. Congressman Broun, thanks very much for being here.
Thank you, Geraldo. Actually, it is a pig that needs to be shot because it's disastrous. It's going to kill jobs. It's making health care already more expensive for folks. I talked to somebody just today, and she said her son's, who's 24 years old, private insurance has doubled since Obamacare has gone into place. We've got to get rid of this. We've got to put in place policy that makes sense so doctors can practice medicine without the encumbrances of a government bureaucrat, and where patients can make the decisions, and where health care is affordable to people.
But let me get the brass tacks here. The House moved one step closer to repealing the plan. You had that procedural vote. It passed 236 to 181, mostly along party lines. But what's the point? You've got the Senate still in the control of the Democrats. You have the president vowing that he will veto any passage of a repeal bill if, in some miracle, it is passed. Why bother? Why waste the American public's time?
Well, Geraldo, we're going to show the American people that the Republicans in the U.S. House of Representatives are different from what they saw in the past, and certainly markedly different from what Nancy Pelosi and company have been running the House. And in fact, this week I'm going to introduce my own repeal and replace bill that does 4 simple things, but those 4 simple things would markedly lower the cost of health care for everybody, for your employees, for the people that I try to take care of in my medical practice. I still practice medicine. The 4 things are these. Number 1, we need to have be able to purchase insurance across state lines. Secondly, businesses and individuals should be able to join an association so that they can buy insurance at a much lower cost than they have today. Thirdly, we're going to stimulate the states to set up high-risk pools, as some states have already very successfully done. And fourthly, to have tax fairness so everybody can deduct 100% of the health care costs off their income taxes. And those things would markedly lower the cost of health care.
That may be, Congressman, and I applaud any idea that saves the taxpayers money while at the same time protecting those of us who are insured from the penalty that we incur when someone who's not insured goes to the emergency room or in some other way, gets public assistance in that regard. My point is, you cannot pass this repeal in this Congress. Where can we show the American people that Congress really cares about improving the quality of their lives, affecting the deficit in a way that is positive for the taxpayer, and moving forward so everyone is covered, more or less?
Well, Geraldo, the bill that I just mentioned, I introduced in the last Congress, plus I introduced a very comprehensive health care reform bill. It's called the Patient Option Act. 106 pages, not almost 3,000. But you didn't hear about those. I talked about them very vocally through the last Congress, but you didn't hear about those because Nancy Pelosi was running this House of Representatives in a very dictatorial manner. And in fact, she didn't even listen to her own constituents in the House, her own members on the Democratic side, which is totally wrong. So what we're doing is we're just continuing what we did in the last Congress. We're putting forth ideas. We were accused by our Democratic colleagues of being the party of no, but we are the party of KNOW because we know how to lower the cost of health care. We know how to solve these problems. We can keep the doctor-patient relationship as how health care decisions are made and stop this slide to socialism and socialized medicine. So we're going to put our agenda for jobs and economy and better health care on the table so the American people can look at it. It's not a waste of time. It's going to be very instructive to the American people so that they know that they have a choice and that they know that they can pick one choice or another.
Okay, Congressman Paul Broun, thank you very much.
Thank you.